Dear colleagues, good afternoon. Let me convey my cordial greetings to all participants of the conference from the beautiful city of St. Petersburg. I would like to tell you about the development of a new medical specialty, osteopathy, and about the path that we have overcome in Russia from empirical experience to the evidence-based medicine. I prepared the lecture in collaboration with my team, Professor Elena Trigubova and Professor Yulia Potyahina. Dr. Elena Trigubova and I are professors of osteopathy department at Mechnikov Northwest State Medical University. And Dr. Yulia Potyahina is a professor at the Department of Normal Physiology at the University of Nizhny Novgorod. Let me say a few words about the scientific component of osteopathy. Osteopathy has always needed the scientific confirmation of the particle empirical data received by practitioners. Even the founder of osteopathy, Andrew Taylor Steele, said that osteopathy is a science which studies a person. He wrote that he started with the bones, with their their articulations, serving all sorts of purposes and uses. Straps attached to the bones, and bones set in motion various forms, surfaces, blocks of the great machine which contains animal life. There was a word that the founder of osteopathy said about 150 years ago. And osteopathy was originally based on the fundamental science, anatomy and physiology. But its early days is opposite itself to official medicine, which used pharmaceutical. One of the reasons for this opposition was the low effectiveness of medicine known in the end of the 9th century. Today, we are well aware that osteopathy is a part of large functional medicine. Of course, it can and should be integrated into complete medical protocol, which should be focused be on the state of the previous disease and the disease itself. From the very beginning, osteopaths have begun studying what they were feeling with their hands, with the help of the tools that existed in the time. As early in 1908, for the first time in the United States, the X-ray equipment was installed in the American School of Osteopathy. Little John identified vertebral mobility disorders and assessment the effect to the functional of excitation and inhibition of the nervous system. Dr. Smith, using X-ray with contrast agent, studied changes in the blood flow and the influence of osteopathic treatment. And Dr. Sutherland developed a series of experiments to test and hypothesis of displacement of the skull bones and head tissue. His experience confirmed the hypothesis that alteration of displaceability of a head tissues affects health. It was in 1929. For almost 150 years of history, osteopathy has come a long way. And the present scientific stage, of course, we can say osteopathic a new approach to the diagnosis and treatment of disease, which is based on scientific evidence. There was an attempt to evaluate the result of osteopathic treatment in comparison with other methods. What exactly does osteopathy do? More and more often, osteopathists say that the subject of research in osteopathy is somatic dysfunction. This is a term that appeared in the middle 60s and was first introduced to the world by the hospital care community of the Academy of Applied Osteopathy of the United States. And today term has taken the place in the International Statistical Classification of Disease and Related Health Problem 11th revision. The code in the ICD-10 is a M99.0 segmental somatic dysfunction. It allows osteopaths to register the result of their treatment and conduct clinical research. You can see on the slide how the request of the keywords somatic dysfunction has been growing in the PubMed publication database since 2012. I would like to remind you that in different types of study there are different levels of evidence. I will list them in ascending order of evidence: experimental opinions, case series and case control studies, cohort studies, systematic reviews, and meta-analysis. There's also rating system for evaluating clinic trials, meta-analysis, which belongs in class 1, class 2, small randomized trials, class 3, non-randomized clinical trials, and class 4. This is consensus building by a group of experts on a given issue. Everything you can see in the frame, all the types of studies are available today and acceptable for research in the field of osteopathy. Of course, double-blind placebo-controlled studies are impossible in osteopathy, just as they are impossible in other non-pharmacological methods, such as surgery, oncology, physical rehabilitation medicine, manual therapy. In these fields of medicine, such studies are impossible by definition. However, in the same time, other methods aim to evaluate the effectiveness of treatment are quite applicable for osteopathy. This is, for example, a comparison of osteopathic correction with placebo and comparison of osteopathic correction with conventional treatment, in comparison of osteopathic treatment with absence of treatment, of a comparison of a complex treatment, including osteopathic correction with conventional treatment. In the middle of 20th century, osteopathy was included in the health case system of many countries. By the end of the 20th century, clinical research in osteopathy began to meet in criteria for evidence-based medicine. In this slide, you can see how the number of cohort studies on osteopathy increased from 1993 to 2020. There was a rapid increase in quality and quantity of the type of research. We also see a tenfold increase in randomized controlled trials in osteopathy. We can also pay attention to the fact in osteopathy there is an object of osteopathic influence. This is a reversible disorder in the functioning of body issues, which osteopaths define in accordance with ICD-10 and ICD-11 as a somatic dysfunction. We see that the term is used in randomized clinical trials and meta-reviews. The path that global osteopathy has traveled for a century and a half, Russian osteopathy has overcome in 30 years. And today, osteopathy in Russia is a powerful scientific branch of medicine. Over the past 30 years, osteopathy in Russia has been building a bridge between healthcare, medical sciences, and osteopathy that excited 150 years ago. When people without medical education practiced it, there was no medical specialty osteopathy. In official documents, there were no evidence-based results of osteopathic treatment. Nowadays, we are building a bridge between the osteopathy of the past and the osteopathy of the future, and for sure we see ourselves as a part of healthcare and medical science. I have already mentioned that over the past 30 years, osteopathy in Russia has come a long way, a very important one, and this way has been complete by now. We have achieved full institutionalization of osteopathy in Russia and legalized it as a medical specialty with various types of training, postgraduate education for medical doctors, medical residency training, and full-time university education after school. A professional standard of an osteopathic physician was approved. Our graduated right, PhD, and doctoral, that is, publish them in journals, all the necessary documents regulating our independent branch of medicine were approved. Osteopathy practice is now regulated as a government. We developed the concept of somatic dysfunction. We define it as a potentially reversible structural and functional impairment in tissue and organs manifested by restrictions of various types of movements and mobility, defined by palpation. It has three components. These three components are represented by the stoma, the fascia, which is a biomechanical shed, which osteopaths evaluate for the change in the display stability. The second component of the somatic dysfunction is a rhythmogenic or hydrodynamic component, which osteopathy evaluate with their hands. They determine altered viscosity, characteristics, changes in the production of endogenous rhythm. The third component is an aerodynamic one, which is associated with the assessment of the reflex activity, active movements, pain, and soreness. Thus, these three components can be represented in the global level, as a regional level, or at a local level, and taken into account the acute and chronic state. We can determine and register these components and subject them to a scientific analysis. Nowadays, the term somatic dysfunction can be understood by specialists in the other field of medicine. Science is based on anatomy, physiology, and pathophysiology or pathology. The assessment and the register of importance of the somatic dysfunction allow us to describe the result of osteopathic correction and conduct clinical research with statistical processing of the result. International cooperation is very important for Russian osteopathy. We have created an international A research group with the participation of scientists and osteopaths from Russia and other countries, Great Britain, Belgium, USA, Malta, France. The result of this work is an article classification and systematization of somatic dysfunction for training, treatment, and clinical research. We approved an osteopathic conclusion form in Russia, which we use in order to access the dynamics of the functional characteristic of tissue in clinical practice. This form is also used for scientific research. We register changes in tissue characteristic in different regions of the body, taking into account the various components. Undoubtedly, the development of scientific research in osteopathy is possible only if diagnosis methods are unified. The proposed form of classification of somatic dysfunction and the methodology of accessing palpation characteristics made it possible to evaluate this characteristic of tissues in different countries and to obtain data that we can change. We develop unified protocols for randomized clinical trials. We proposed a method of registering the osteopathic status. This is an osteopathic conclusion form with the determination of the dominant somatic dysfunction. Since 2010, we have been published in the Russian Osteopathic Journal. It is the only osteopathic journal accredited by the Higher Attestation Commission of the Russian Academy of Sciences. More than 50 issues have been published by now. There are at least 10 articles in each issue. We would be happy to see you among readers of this journal. The impact factor of this journal is growing rapidly. The number of authors is growing and number of articles viewed per year is increasing. Not so long ago, the Russian Osteopathic Journal entered the COPUS situation database, Scopus, so it will now be seated at such a high international level. When analyzing scientific articles published in the journal over in the 5 years, it was noted that 48% of the articles correspond to a high level of evidence. This is meta-analysis, reviews, randomized clinical trials, and case control studies. And this list of journal in which article by Russian osteopathic physician and published is quite large. This article published in major Russian scientific journal. They enter in the Web of Science and Scopus database. Today, thanks to close work with medical doctors with specialists in scientific and various fields, we are always, the osteopathic correction has influence on pathogenics. Osteopathy improves tissue mobility and restores coordination of movement due to connective tissue remodeling, normalization of muscle tone, and restoration of interneural connection. Osteopathic correction leads to an improvement of lymph flow and decrease in the viscosity and volume in interstitium. Decrease the metabolism and the immune defense improve. There is a release of vasoactive substance with activation of venous return and blood circulation improves in general. Nowadays we understand that osteopathic correction reduces pain due to the anti-inflammatory effect. The activity of nociceptors decreases, the parasympathetic tone increases, as well as the level of analgesic factors. Osteopathic correction also reduces the importance of stress, anxiety, and depression, and increases the level of oxytocin, endogenous and cannabinoids and endorphins. As a consequence, the regulation process, the adaptive capability, as well as work of organs and system improve. Nowadays, we can confidently say that Russian scientists have made a significant contribution to the development of osteopathy. And Professor Moskalenko and co-authors studied slow wave processes in the brain. They instrumentally proved the presence of involuntary rhythmic movement and the head region associated with hemoliquid dynamic. This also substantiated the possibility of correction alteration of hemoliquid dynamic of the brain with the help of osteopathy. Together with my team, we demonstrate that osteopathic correction improves joint mobility and postural balance based on the measured by viscoelastic properties of the tissues. Professor Patyahina and her team proved that osteopathic correction caused a decrease in the muscle tone and improvement in blood supply to the muscles. Professor Bilash at using ultrasound diagnosis proved that osteopathic correction improved blood flow through the vertebral arteries and venous outflow from the skull. Dr. Oreshka and co-authors ultrasound diagnosis showed the improvement of the constitution function and gallbladder after osteopathic correction. As you can see on the slide, our scientists actively publish in monographs and receive patients. It is certainly necessary to develop scientific research in the field of osteopathy and somatic dysfunction and to create scientific models explaining the mechanism of action of osteopathy. Undoubtedly, osteopathy has certain limitations as well as functional medicine in general. Nowadays, there are not enough technical means enabling osteopaths to register what they access with their hands. The body is quite a complex machine. It is impossible to study everything at once and to measure all the subtle regulatory processes which take place in the body, and it's also important to take into account the relationship with the external environment. Currently, there are many theoretical models and approaches in osteopathy. The concept of somatic dysfunction also presents a certain technical complexity. At present, we use methods of evidence-based medicine, develop the concept of somatic dysfunction, rely on objective methods of assessment of patients, and explain the result of osteopathic correction. We hope that osteopathy will be able to build a bridge to healthcare and medical science, and future generation of specialists will pass over the bridge, helping thousands of patients in a functional stage of the disease. Therefore, the road is made by walking, and I would like to wish all the participants of the conference a happy interdisciplinary path which we follow together. Thank you for the attention.